I'm representing the group which was focusing on advocacy and communication. And I must admit that this group was quite energetic and quite good, despite missing the 1,000 special days of scaling up nutrition in the early childhood stage. The center focus was to look at what is advocacy. We thought advocacy is a process of trying to inform, influence, but also catalyze investment or raise awareness on nutrition, especially when you look at the linkages of agriculture, health, and nutrition. I think that was what preoccupied our debate. But also we looked at influencing decision makers, policy decision makers. We were saying that sometimes there is a notion to distance yourself from not being a decision maker. But I think decision making starts at the unit of a household, or even at an individual level, household, and then community, and then you come at district, regional, and then you come to the national level. We thought that is important. But also I think one last notion we centered on is to make sure that in whatever we do in terms of advocacy, there is a grassroots involvement, because there's a tendency not to appreciate the indigenous knowledge that is in the communities. So this group managed to come up with the 3 actionable items. Can I ask one member of the group probably to come and support me? The understanding was also that we are not starting from a scratch. In the Ministry of Agriculture, Healthy, but also the Department of Nutrition, there already some work that is being done. And what we thought, despite this being the first one, this is a process that we went through. We realized that number two, this one, which was number 2, it's more of the first action that needs to be done. Platform for networking and information sharing for the 3 sectors. We are looking at an avenue like this one, where I think it's the first of its kind. Why don't we institutionalize it and make sure that we have more of these kind of platforms where information is being shared, and the efforts are mainly trying to establish the linkages between, amongst agriculture, health and nutrition. Number 2, we were saying, yes, you can do advocacy, but if it's not coordinated, it might not be effective. Yes, you want to communicate, you can have the facts and the figures, the evidence-based advocacy, but if it's not coordinated, it will not be effective. We were saying, if we have an institutional arrangement, if we institutionalize that platform for networking, there is a need to have a harmonized way of working, a coordinated way. That's why we are talking of develop a strategy for advocacy and the communication on agriculture, nutrition, and health. The whole idea is we have been informed reliably that there is already a strategy that is being developed for nutrition, education, and communication. But we thought it's important to also look at this document to make sure that it embraces the linkages we are talking about, that issues of agriculture, issues of health and nutrition are embedded, are taken on board. Secondly, we thought this is a nutrition, education, communication strategy, but we want to bring in the advocacy element, so that when we are talking of this strategy, we are talking of an advocacy and communication strategy. The last one, which is development of relevant and targeted IEC materials through relevant media. That's, I think, an issue. The struggle we had, we thought number 2 and number 3 could be part of, or number 3 could be part of a strategy, but we thought if we do that in this presentation, it might lose the prominence. So we just highlighted as such. Finally, the emphasis is, this is just a matter of rebranding. I think there is already good work that we are doing in various sectors, which now we are bringing the element of linkages, but also we are talking about advocacy and communication. To that extent, I want to thank you for your kind attention. Thank you.